Let's look at this figure, and I would like you to speak to it, that projects that 1 out of 4 Nigerians, an estimation of 60 million Nigerians, has to live in one form of mental illness or the other. Talk to us about how serious this figure is, or the situation is in Nigeria.
Yeah, it's pretty serious because, of course, when you have 1 in 4 persons having mental health issues, then of course it means that it's going to affect every area of our country, economically, socially, and that's why, of course, you have now people resorting to substance abuse. It also has a huge effect on our economic development. If, for example, someone is not well mentally and we have certain issues in this part of the world, for example, now we have the cultural or the beliefs. Nigeria is a religious country where at the mention of I have some at the mention of the word mental, people start to wonder what's your problem, God forbid. And before you know it, it makes you not want to become vulnerable, not want to seek help. And because of this, a lot of people, are going through issues mentally. And this can be far-fetched because when you think about the economic issues we're having, for example, the exchange rates, the subsidy, and the issues we've been having since COVID, you know, it's really alarming. That's just what I would have to say at this point.
You talked about the issue of substance abuse. I would like you to talk about the relationship between substance abuse and mental health or mental illness. Is there any relationship, and what could be the impact on the mental wellness of a human being?
Okay, so let me start by even explaining what mental health is. Mental health is, of course, your emotional, psychological, and social state of being. Now, for example, humans, we live in three different worlds. We live in the spiritual world, we live in the physical world, and we live in the mental slash or emotional or psychological world. Let me not delve too much into the spiritual world, but of course, we believe that we have this primary belief that we're spirit beings. You understand? There's a spiritual aspect of us. The physical is the physical aspect that we all can see, the hands, the body, and all that. Do you understand? Now, mentally, psychology is how you think, how you reason. And these are things that helps you learn, help you build ideologies, how you think, how you learn, how you cope with stress and all that. And it is highly essential because without the mind in the proper state, every other thing is useless. Look at the like of Cobams, the musician. Cobams is blind. So physically, he has a defect, but Cobams is a successful man in the music industry. Think about someone like Yinka Ayefele. Yinka Ayefele is crippled. He had an accident and he lost his legs. So physically, he's impaired, but yet he's a successful man. But the truth is, the moment you have mental illness or you have issues with your mind, it's finished. You can't be successful. Because how can you think? How can you reason? How can you live a normal and fulfilling life? It's difficult. So when you understand this, when people now have issues, because for example, pain, I often say that pain is inevitable in life. There are times at some point you go through the normal stresses of life, you lose a job, you lose a spouse, or lose at some points your parents would pass, they'll pass on, and you have to deal with these issues. Some people even deal with childhood experiences, maybe bullying, or some experiences they had that's really affected them mentally, and they grew with these issues. Now, when people, for example, you lost your job and this is a typical example now, you lose your job and you're trying to get another job, you have family, you have school fees, you have to deal with all these things. What people normally resort to is finding a way to suppress the pain, suppress the emotion. So, for example, people take to the easiest way or the easiest thing to resort to is alcohol. Because if you look around you now in our society, there's almost a beer parlor or a joint around. So people will just go because they want to forget their sorrows. They want to quell their pain. And in the process, taking to these substances, they forget that when you start to do something over time, it's called elasticity. You now build a habit around it such that when it gives you or it provides you that temporary relief from that pain, you resort to it every time because you think that that's the easy way out. So people resort to alcohol, and in no time they begin to develop addiction. And of course, over time, addiction, alcohol, all these substances also has an effect on your health. So I don't know if that relationship now, I don't know if it makes sense. That's relationship within mental health issues and addiction, which of course comes back to affect economic development and the overall well-being of the nation.
Great. Now let's focus now on the role of mental health in community development. Now, what kind of communal support or services should be given to someone who is battling with mental illness in the community? What kind of structure are you expecting or should be put in place to offer support or services to someone battling with mental health in the community?
Yes, so we need to create a lot of awareness because yes, Nigeria is naturally or fundamentally a religious nation, and religiously we always think that to have mental issues is a taboo. To have mental issues is a no-no, and the average Nigerian, when you say, "Oh, I have a mental issues," the response you get from an average Nigerian is, "God forbid, you cannot be mentally derailed or you cannot have mental issues in Jesus' name." I rather than take you to a mental health facility or the hospital, they rather take you to church for prayers to the pastor, or rather than take you to a counselor to speak with you, to offer you psychotherapy. Psychotherapy is called talking therapy, where you're being spoken to. You know how sometimes there's a saying that a problem shared is half solved. So sometimes when we unburden, when we speak about our issues, the issues that bother us, it has a way of making us feel relieved. More often than not, the first thing a therapist does is to just listen to the client. And in listening to the client, when the client onboarding the stress or onboarding those issues he has, he feels much better. Now, in creating awareness, we need to create awareness to debunk, demystify, or to dismantle this belief that we have that mental health or mental issues is a taboo or is bad, because there's this phrase that most have been going around, and it says it's okay to not feel okay. It's okay to not feel okay. It's normal. There are times that you won't even just feel like, the conventional mood swings we have sometimes. When you wake up in the morning, I don't even feel like going to work. Sometimes you don't feel like eating. Sometimes, so these things are normal, especially when we have these hormonal changes, not which is not even just subjected to women when maybe they have they're bearing children and all that. Women also have it, especially when we're going through stress. That's why a man will come back home to meet his spouse and not feel like having sexual intercourse with her because he's having some issues in his mind that made him not interested in sexual intercourse. So if we raise proper awareness by creating programs, by always creating, and this is the churches are actually helping, or maybe let me say non-for-profit organizations are actually helping in this regard. And there are associations, there are organizations, mental health organizations that are actually working in this regard. But what we need is more awareness. The more awareness that goes out there, it will begin to dismantle this belief that it's not okay to feel it's wrong to have mental health issues. So the average Nigerian will understand that when I do not feel okay, it's okay to feel like that once in a while, and it will be easier for them to seek support. It will be easier for them to speak about their issues. So I think that's one major thing we need to work on, that awareness. And then we also need to dismantle this stigmatization. We need to work on the stigmatization that people usually the stigma, surrounding mental health issues, because I think that's the major problem that we have in this part of the world. In more developed nations, the moment you even, if, for example, you're at the workplace and you just tell your boss or your employer that you're not feeling well, your boss will be really concerned and say, "Oh, do you need a week leave? Do you need to go home? Do you understand?" But this part of the world, we want you to even work on that duress. We want you to work on that stress. We don't care if you're suffering emotional issues, or we just want you to keep working. So if these things can be put in place, certainly things will begin to change in the society.
Let's look at the rural areas where likely people do not have access to healthcare, the conventional healthcare. Now we're talking about mental wellness. We're talking about the role it's going to play in community development. What kind of facilities can be put in place at the communal level to ensure that people get help when they need, assistance when it comes to mental illness?
So naturally, ideally, every hospital should have a section for mental health. It's just ideal because, of course, there are different sections in a hospital. So ideally, that should even be there. But like I said earlier on, the reason why people would not go to a psychiatrist or go to a counselor or go to a therapist is because of the stigma surrounding it. So I think that yes, it's important for communities, and this is where not just this is not the federal government now. This is the local government in because the local governments are the ones who are closest to the individuals. You understand? It's not the federal level or the state level, but the local governments, those in our communities. We should have, for example, there's something called mental health first aid. Just like you have the usual first aid when maybe someone like in every home now, you should have a first aid. There should also be a mental health first aid. There should be a helpline that you reach out to when you do not feel well. So for example, in developed nations, you have an emergency, you dial 911. There are also hotlines that you can also dial to seek help. So I think in the community level, first things first, of course, in villages or rural areas, they may not be so educated. They need proper education at that level. And that's where you now need individuals who would be posted to these areas, experts, counselors, therapists, psychiatrists, who can go and go to these communities and create proper awareness, educate them, because at that level, of course, they are ignorant. They are completely ignorant, and the people that are going through even worse over there. And because of the ignorance, they don't even know these issues exist. You just hear that someone slumped and died. This person, something happened to this person, and all that. So I think at those areas um you need proper awareness in those areas for people in those vicinities in rural areas to be well educated. This could also, I think, even for example, the youth for the NYSC, those going on NYSC, some of them, for example, be posted to communities for them to, work on this particular initiative addressing the rural communities on mental health. So, like I said, it is we need proper awareness all over the nation, especially, of course, in those rural areas, because those ones, of course, they are oblivious of this thing. And you see, what mental health has been on for us as since the history of time. But I think we started facing the realities during, I think, maybe a few months before COVID, when people started jumping off Third Mainland Bridge. That's when it became a reality, started dawning on us that mental health is a real issue. So I quite agree with you.
All right, since we're talking about community development, let's look at what role the local government authority should play in promoting, mental wellness as far as community is concerned. What kind of structure would you expect a local authority to put in place in order to promote mental wellness in a community?
Okay, so we still so it still boils down to first things first, the community leader, the local government chairman, and the like, creating or putting programs in place to create awareness. creating programs, youth programs, even that, of course, adults can, can attend, the elderly can attend. You know how, people, this, what do they call them? You know how people go to each homes to vaccinate children, kids. You can have a group of people go around to communities, create proper awareness, go meet them, because sometimes you see people who would not attend these programs because they do not believe in it, except maybe when they hear they are sharing palliatives. So yes, if such an initiative can put in place where the members or this group of people reach out to communities and create this proper awareness, then when the awareness is created, a facility should also be created in each community where people can go and meet experts, go and meet counselors, psychiatrists, and counselors, and explain whatever it is they're going through. And of course, proper infrastructure needs now to be put in place for people to have access to the required drugs, the required therapy at almost little or no cost. Because sometimes, of course, when you cannot even afford these things, do not come, they're not cheap. So it can be quite expensive. And when people think about the cost, of course, they won't even think about that option. And that's why you have people go on self-medication as opposed to going to the hospital. But if you think about Nigeria as a nation, the health sector is a major challenge that we have. And that's why you see a lot of, we have the brain drain in this society, in this country is really high. There are a lot of people now traveling out of the country, So if that can be addressed, proper awareness, proper infrastructure being put in place, programs being created periodically, 3 months, people reaching out to people at their communities sincerely, it will create the awareness and it will make people start to come out to ensure that they get the proper mental health care that they need. So I think that for the leaders, they have to believe in this thing. And when they believe in this thing, of course, they'll go all out to ensure that they do the necessary things to ensure that these facilities are being put in place. So, like I said, fundamentally, Nigeria is a country that has this religious belief that mental health is a no-no. It is forbidden for you to have mental health issues. But if you can debunk, if you can dismantle this belief primarily, and by creating proper awareness, creating programs that would, change the mindset of people, then I believe that the changes would not begin to work. So that's it. We just
All
need
right.
more. We need more devotion. We need more dedication to the health care of our nation. Because even naturally or primarily, even access to healthcare is like a luxury in Nigeria. That's why you have a lot of people, emergency cases, they would rather seek, to go to the pharmacy as opposed to go to the hospital because the cost, and then you get to maybe for emergency cases, you get to the hospital, they are seeking a police report or they are making demands that at that point cannot be met. And then you see people just naturally, that desire or that initiative to go to the hospital dies. So there's a lot of work that needs to be done.
Great. Let's look at the issue of the mental health bill, which was signed into law early this year. How much of impact has this been on the issue of promoting, the awareness about mental health? And then has it gone further to tackle the issue of knowledge gap when it comes to the issue of mental health in Nigeria?
There was I heard about, I think it's true though, where I think there was this policy, or I don't know what it's called, that was passed that if you're caught trying to commit suicide, then you are going to be subjected to a jail term. I think sincerely that's ridiculous to start with. For someone for someone who is attempting suicide, that such a person has even given up. Such a person has quitted on life naturally. So that person is as even taking the courage or taking the bull by the horn to even take his or her own life. And then when such a person is caught, or such a person is prevented, yeah, caught, you now subject that person to a jail term. I think that's ridiculous. So you see, our policies, I think we need to look into our policies once again to ensure that you see that we're not even these people who were trying to save, we're not even adding further pain or adding further issues to them. Because someone that has given up on life, and then you sentence this person to jail, or sentence this person to jail, then you're only adding to that person's problem. It's only a matter of time that this person would even commit that suicide, even in jail. I know that yes, there are measures even within the correctional centers that ensure that people do not commit suicide, but it worsens the problem. So I think that we need to work more on the policies. We need to work more on ensuring that we are not doing more harm than good to the average Nigerian out there. That's what I think, in my opinion.
Before we wrap up, I would like you, as an expert, to talk about what people need to do in order to be able to manage their mental health. It's important to give tips on how to manage mental health so that somehow prevention can be better than cure. So what are your tips?
Okay, so yes, there are a lot of tips. First things first is about there's something called cognitive reframing in psychology, and it essentially means you changing the meaning that you give to events. There's a saying that nothing means anything except the meaning you give to it. So it's not our issues that actually gives us stress. It's the mental interpretation we give these issues. So for example, you lose a job, you could change your perception about it. You could tell yourself that perhaps God wants me to get another job. God wants me to move on from that particular job. So when we change the way we see things, there's a saying that when you change the way you see things, so you change the way you look at things that you look at will change. Another thing again is, so that first thing is about changing the perception we give things. Secondly, how often do we truly rest? Because you see, sleep are highly underrated. The average Nigerian, even when he's on vacation, is thinking of a side hustle, is thinking of a way to keep making money. We don't rest. The nature of the way the system works, do a night, not even 9 to 5 anyway. Sometimes it's 8 to maybe 6. You're in traffic all through to maybe 9, 10 p.m. You get home, perhaps there's no electricity at home, and for some reason you don't get that proper rest. The next day you are out again trying to find your daily bread. We need to start having quality rest. Take time to sleep well, take time to rest well. That's another thing. Another thing again is we need to learn to onboarding. We need to find trusted people within our circle that we can speak to about our issues. We may not be able to go to the counselor, to the therapist and all that, but there are people within your circle that you can onboard them, you can speak to, you can share your issues, you can get that social support. That's why you see during Christmas, people are often so happy because of the fact that people know that it's a period where they will meet loved ones, they will unite, they will rest, and again, be free from the stresses of life. And it's all about, I remember during COVID when the phrase, the World Health Organization came up with this phrase, social distancing, and then they had to change it to physical distancing because you see, we're social beings, and that social interaction we cannot do without it. And that's why if you place a man in solitary confinement, a man who is in prison, in solitary confinement, it will even kill him even more than just imprisoning him, because that social interaction is very important, and that's why we need it. And if you look at the kind of society we live in, Owambe's, partying, social interaction, all these things really helps. And I would really advocate that, yes, we indulge in more of that because you see, it really helps us, ease the stresses of our lives. And there are a lot of other number of strategies. I think finally, I'll just speak about focusing on the good side of things because the truth is, if you look around you, you always see negativities. But if you discipline and program your mind to focus on the positive things around you, society, it would really help you in faring better. It will help you in managing yourselves and miss the issues or the things that actually stresses us. So focus on this. There's always something good around you to see. Being alive is something to be grateful for. Being able to move freely in your environment, access to food, clean water, all these things are things that we should be thankful for. So we should always just, complain and focus on the negative things, but also think about the positive things and be thankful about them. So I think these are just good enough to start with. Thank you very much.